Hello everyone. Welcome to the Docsaab's Diary. And I am thrilled to have this opportunity to dive into a topic that is profoundly critical for any healthcare professional, the art and science of effectively communicating difficult news. In our demanding roles, we often find ourselves needing to deliver information that can be life altering, challenging, and emotionally charged for our patients and their families. This isn't just about conveying facts, it's about navigating human emotions, building trust, and providing support during incredibly vulnerable moments. Today, we will be focusing intensely on the SPIKES protocol, a widely recognized and evidence based framework designed specifically to guide these sensitive conversations. The goal of Spikes is to ensure that even the toughest news is delivered in a way that respects the patient's dignity and autonomy, genuinely supports their emotional needs, and thoughtfully sets the stage for their continued care and coping. It's about communication that heals even when the news itself cannot. So, what exactly is the Spikes protocol? It's a robust six-step communication framework meticulously developed for healthcare professionals specifically to deliver bad news. Think of it as a comprehensive roadmap for these challenging interactions. The primary aim of spikes it is to ensure that the news is not only delivered clearly but also empathetically, always keeping the patient's perspective and autonomy at the forefront. This structured approach helps minimize the acute distress patients often experience when receiving difficult diagnosis or prognosis. But it's not just for the patient. It also significantly helps reduce emotional burnout for the clinicians, providing clear, actionable guide in situations that are inherently stressful for us too. By systemically following these six steps, clinician can build stronger, more authentic trust with their patients, facilitate more effective coping mechanisms, and ultimately improve patient understanding and adherence to treatment plans. It transforms a potentially chaotic and overwhelming moment into a managed, compassionate exchange. The first step, setting up the interview, is absolutely foundational. It's about meticulously creating an environment that is conducive to a serious, sensitive, and focused conversations. This isn't just a formality, it directly impacts the patient's ability to receive and process difficult information. First, prioritize creating a private, quiet, and comfortable environment. This might mean using a dedicated consultation room, ensuring doors are closed, and choosing a time when you won't be interrupted. Actively minimize interruption by turning off your pager or phone and arranging for colleagues to cover you if needed. This demonstrates to the patient that they have your undivided attention and that their conversation is paramount. Critically, sit down with the patient rather than standing over them. Studies have shown that this simple act can significantly increase a patient's perception of the time spent with them and makes their interaction feel less rushed and more compassionate. Maintain open posture and eye contact to convey engagement and trustworthiness. Lastly, always ask if the patient wants support person present. This respects their autonomy and ensure they have their chosen support system during a vulnerable time. Their answer might guide who else in the room, a spouse, a family member, or a friend. This thoughtful preparation lays the groundwork for a truly empathetic interaction. Moving on to the combined steps of perception and invitation. These are crucial for tailoring your message and respecting patient autonomy. For perception, your goal is to assess what the patient already knows or suspects about their condition. Avoid making assumptions. Instead, use open ended questions like, what is your understanding of your condition so far? Or what have you been told about the reasons for this test? This helps you identify any misinformation, correct false hopes, or address existing anxieties. It's about starting where the patient is, not where you think they are. Then we transition to invitation, which is about asking how much information they wish to receive. This step respects their individual coping styles and autonomy. You might ask, how would you like me to give you the information about the results? Or would you like me to explain all the details or just the main points? Some patients prefer general details first, while others want every specific. Some may even prefer to defer the detailed discussion. Respecting this choice is paramount. If a patient indicates they prefer less details, you can say, okay, I'll give you the most important information first, and we can go into more detail later if you wish. This approach prevents overwhelming them and empowers them in a situation where they might feel powerless. The knowledge step is where you deliver the information itself. This is often the most challenging part, and careful delivery is a key. Begin by giving a warning shot. This prepares the patient for the difficult news to follow, acting as a crucial buffer to the shock. Phrases like "I am afraid I have some bad news" or "unfortunately the results are not what we had hoped for" can gently signal the gravity of the situation. It's vital to use simple, non-jargon language, avoid complex medical terms like metastasis, and instead use clearer terms like spread or growth. Remember, patients are often processing intense emotion, and complex terminology can add unnecessary confusion and distress. Provide information in small, manageable chunks. Don't overwhelm them with too much detail at once. After delivering a key piece of information, pause and check for understanding periodically. Ask, does that make sense? Or what are your thoughts on what I have just said? This allows them to process, ask questions, and ensure they are following along. If there is any initial good news, like the cancer has not spread beyond this area, deliver that first to cushion the impact before moving to the more challenging aspects. Empathy is arguably the heart of the spikes protocol. It's not just about feeling for the patient, but about actively recognizing, validating, and responding to their emotional response. After delivering the difficult news, observe the patient's reactions. Are they silent, tearful, angry, or in shock? These reactions are normal. Don't rush to fill the silence or change the subject. Instead, use empathetic statements that acknowledge and connect their emotion to the news. For instance, if a patient starts crying, you might say, I can see how upsetting this is for you, or it's completely understandable to feel this way. If they express fear, you could respond with, I can imagine how scary this must be to hear. The goal is to show that you are present with them in their pain, that their feelings are valid. Offer support, whether it is simply a tissue, a glass of water, or just allowing for a moment of silence for them to process. Sometimes the most powerful thing you can do is simply be present, listen, and convey, I am here with you. This step builds immense trust and strengthens the patient's provider relationship, making them feel seen and understood during their most vulnerable moments. Finally, we arrive at strategy and summary. This is about moving forward from the initial shock to creating a clear, actionable plan for the future. This step significantly reduces anxiety and provides a sense of direction amidst uncertainty. Begin by collaborating with the patient to outline the next steps. This could involve further diagnostic tests, referral to a specialist, discussions about treatment options, or palliative care. It's a crucial to summarize key information shared during the conversation to ensure the patient has grasped everything. Ask, what did you understand based from our discussion today? Or do you have any questions about what we have discussed? Then work together to develop a concrete plan. This creates a sense of control and hope. Offer continued support and reassurance. Let them know what you and your team will be there for them throughout their journey, guiding them through the process. Reiterate your availability for future questions and follow up. A clear path forward, even in difficult circumstances, provides stability and helps them begin the process of coping and planning. Beyond the six individual steps, the Spikes protocol embodies several overarching key principles that underscores its effectiveness and benefits. Firstly, its adaptability means it can be effectively used across various medical settings. from oncology to emergency medicine, from primary care to palliative care. It truly promotes patient centered care, always prioritizing the individual's needs, values, and autonomy throughout the communication process. The profound benefits are evident on multiple levels. For patients, consistent use of spikes leads to reduced psychological distress, helps them cope more effectively with their diagnosis, and crucially, fosters greater trust in their medical team, often leading to improved adherence to treatment plans. For us as clinicians, having a structured framework like the spikes provides a clear roadmap, reducing uncertainty and stress during these challenging interactions. This contributes directly to clinicians' well being, helping to mitigate burnout and reinforcing the importance of compassionate, effective communication in our demanding roles. It transports the daunting task into manageable and meaningful one. Thank you for your dedicated attention to this critical and deeply human topic. Mastering the spikes protocol is truly more than just learning a technique. It's an act of profound compassionate care that impacts patient well-being and strengthens the invaluable patient-provider relationship. I strongly encourage you, all of you, to practice and integrate these steps into your daily interactions, continuously refining these vital skills through self-reflection and experience. Your dedication to effective and empathetic communication truly makes an immeasurable difference in the lives of those you serve. I am now open to any questions you may have via comments, and please like, share, and subscribe to the Docsaab's Diary. Thank you, guys.